Levels of Alzheimer's disease biomarkers begin to change many years before diagnosis. Few long-term studies have measured these levels longitudinally, especially in Asian populations. In this multi-center nested case control study, participants in the China Cognition and Aging Study who were cognitively normal at baseline underwent cerebrospinal fluid testing, brain imaging, and cognitive assessment at least 3 times during a 15 to 20-year period. Of these participants, 648 received a diagnosis of Alzheimer's disease during follow-up and were matched to 648 participants who remained cognitively normal. The main analysis showed a sequence of estimated time points at which each biomarker level diverged between the two groups. From 18 years before diagnosis for cerebrospinal fluid amyloid beta 42 levels to 8 years before diagnosis for hippocampal volume. Cognitive scores diverged 6 years before diagnosis. Biomarker levels continue to diverge after these time points up to the time of clinical diagnosis of Alzheimer's disease. In the Alzheimer's disease group, biomarker changes appeared to accelerate and decelerate as shown on the y-axis as scores worsened. Peak rates of change in each biomarker level corresponded to scores of approximately 25 on the mini mental state examination and 11 on the logical memory test. The authors conclude that in patients with sporadic Alzheimer's disease, biomarker levels began to diverge from levels in cognitively normal adults at specific time points in a temporal order starting 18 years before clinical diagnosis. Full study results are available at NEJM.org.